Good evening, everyone. Migraine in children is oftentimes overlooked and left untreated. The impact of migraine on a child's quality of life has been well documented. Emotional issues and school performance are among the most common problems, over which need to be discussed well on an appropriate social platform. My name is Himanshu Gupta, and today we are here to do the same. And to do this, we have with us Dr. Diptanshu Das. Dr. Diptanshu Das is a consultant pediatric neurologist at Medica Superspecialty Hospital and Institute of Child Health, Kolkata. He is the editor-in-chief of ILA Wikipedia project and member of Education Council and Publication Council of ILA. He is also a board member of Wikimedia Medicine, a long-term Wikipedian, and an open knowledge enthusiast. After his MBBS from Medical College Kolkata, he has done MHSC in Clinical Child Development from University of Kerala and MD in Pediatric Neurology from University of Rome. That was in Torvegta. His experience of 14 years is coupled with a genuine concern for his patients. Dr. Diptanshu Das, I can keep on speaking about you this whole evening, but I will stop here. And on behalf of Altius Biogenics, I invite you to enlighten our viewers about migraine in children. Sir, over to you, please.
Thank you for the introduction. I'm flattered actually. But migraine in children is really a concern that people need to have. We get a lot of patients with migraine. Uh, in fact, while people uh, come to us with neurological issues, they do not have in consideration that migraine is a very important issue that needs to be kept in consideration. Uh, the prevalence of migraine ranges somewhere between 10% to 20%. So a lot of children really get migraine. In that case, the primary thing that we need to keep in mind is what exactly uh, are they coming with? They are coming with headache. Uh, Headaches broadly are of two types. One is primary headache, the second is secondary headache. What am I talking about? Now, suppose somebody has a brain tumor. Uh, that is the primary cause of the headache. So headache in this case is secondary. So if that is not the case, if the headache is the main problem, that is called primary headache. In our case, the task is to identify secondary headaches and not to mess them up. Primary headaches form the bulk majority, and that includes migraine as well. There are other entities like tension type headache, there are trigeminal neuralgias, but uh, migraines form a major bulk. How do we understand that it's a migraine? There are certain telltale signs that we see in case of a migraine. The first thing we'll have to keep in mind is the onset. If a child develops a headache suddenly, suppose the child was not having any headache uh, prior to that, and over maybe a fortnight or something, the child has developed headache. So, is this concerning? The answer is yes. There are certain things that we need to be kept in mind. If the child has a recent onset headache and not something that is long lasting, that is probably a cause of concern. If the child has headache after the child say goes for an online class, if has various stressful situations, probably would not get concerned. But those headaches are more in the afternoon. If the child has a headache right in the morning, that is probably a cause of concern. Usually, in case of ominous headaches, there are associated nausea, vomiting. So that could be indicative of migraine or something else as well. So if these are present, we'll need to get concerned. Uh, Talking about the age distribution, uh, children as low as 3 years can get migrainous headaches, but uh, mm, but if this headache uh, occurs in children less than 3 years of age, that's a cause of concern, and you'll need to see a doctor. Uh, if the headache onset is, I've already mentioned about a sudden onset headache. If right at the onset the headache is severe, suddenly you get something like a thunderclap headache, it's a cause of concern. Uh, if the headache occurs while the child is training, uh, it could be of concern. It could also be associated with changes in mood, mental status, or alteration of school performance. These are red flags that we need to keep in consideration. If the frequency and severity is gradually on a rise, and uh, we see that the child was maybe having headache for long, and suddenly the child gets the headache, but there's increase in the frequency or the intensity or both. So that could be indicative of something ominous. Uh, if there's vertigo or lightheadedness associated, probably we'll have to look deeper into what could be the cause. Uh, if there are other neurological signs like perioral numbness, if there is a fainting, other things that you can't otherwise explain, that could be concerning. So, in such a when the child just has a mild headache lasting for a couple of minutes, probably you need not get concerned. But if I mean, it's related to the things that I'm mentioning, it could be concerning, and you need to see a doctor. Now, in case of migraine, the disposition could involve one half of the head. It could flip sides on occasion, but that's not always the case. In migrainous headaches, the children usually have nausea and vomiting associated, but that might not always be the case. Uh, Usually, migrainous headaches are relatively severe. They last for a while. For example, it could last for a couple of hours. It could go on for as high as 72 hours or more. So, naturally, that is debilitating. The child would be unable to do things during this period. The child would be just not able to continue with the normal things that the child otherwise is used to doing. Most often, these children uh, have a preference to remain in the dark, or they feel a bit soothing if they are resting in the dark after switching off the light, and even in a quiet place. So if a child has a such an episode, they'd probably be looking for a quiet room to go and rest. Uh, if these are seen, uh, probably you'll have to suspect that the child could have migraine. Usually, these are associated with a strong family history. So, if the mother and or the father has migraines, probably your child could get migraines too. Stress could be a factor, and stress could aggravate migraines. So, in such a case, lifestyle modification could have a role to play. Overall, the lifestyle uh, has a role to play. So, in such cases, I think it's very important to understand what's going on. Migraines are things where you would not really get anything in a test. Uh, if you suppose go for a CT scan or MRI, can you diagnose migraine? The answer is no. It's not so simple. In case of primary headaches that I mentioned, you need to uh, basically you'd not be getting anything out of any investigation. The diagnosis would be clinical. Uh, in case of migraines, one important thing that you'll have to keep in mind is migraines are treatable. Uh, Treatment could be hard, but nevertheless, it's possible. Uh, the treatment will depend upon the frequency. If the child gets uh, episodes rather frequently, uh, you might need a medication that prevents the episodes from occurring. On the other hand, if the child has episodes once in a while, maybe once in a month, once in a couple of months, once in 6 months, something like that, uh, ongoing treatment is not needed. You'll have to understand, suppose the child has a headache. Uh, there are two things that you can do. One is give a medication that stops the headache. There are various painkiller medications like naproxen. There are others like ibuprofen. Your doctor could write those. Often, paracetamol can also be given. There are other medications called triptans, which could be given if the headache is severe. And in such a case, there is a nasal spray also available, and that could also be given. Uh, so basically, the treatment of migraine goes into two categories. One is where uh, a particular medication is given on daily basis so that you do not get the migraines. The other is the ones that are given when the episodes have already started. So if the child is already having a headache, chances are that giving that migraine prevention headache medication will not really help. Uh, Most children, uh, though not all, get a premonitory symptom that indicate that something is not right, and they get used to that. This could indicate that uh, episode is going to start. This is called aura. There are various characteristic aura that the children can get, and that could indicate that a migrainous episode is going to start. This happens in migraine with aura, but there are other episodes which are there are other types where migraine does not occur with aura. So there's a type with and there's a type without aura. There can be chronic migraines, which means that the migraines are rather the migraines keep coming back. Uh, there are other types which involve abdominal cramps, pain, which otherwise your doctor, not all doctors might relate that okay, the child is possibly having an episode of migraine. So, in a nutshell, a lot of things can be there. I'm not going into the technical details, but if you see such presentations, I think it would be a good idea to consult the doctor. Uh, the doctor could or might not ask for a um, neuroimaging. I've mentioned some red flags which would mandate neuroimaging, but that is not always the case. You might not always need a neuroimaging to be done, because I mentioned that migraines are not always they do not get diagnosed with investigations. Uh, there are other associated factors that could be present. Uh, for example, uh, suppose the child has, uh, wait, and suppose the child has fever, weight loss, or fatigue. Now, these are ominous symptoms. If your child's headache is associated with these, probably the child could be having an infection. It could be something more severe, and so this needs attention. There could be secondary risk factors like immunosuppression, cancer, which could be associated. So these are things that need to be looked into. If the child has neurological symptoms, for example, seizures, altered consciousness, focal deficits, that is, there are certain neurological signs that are involve particular part of the body. That could be indicative of encephalitis or brain infection. It could be indicative of tumor in the brain. It could be indicative of stroke. So these are signs that you need to look out for. I've also already mentioned that thunderclap headache or sun, sudden severe headache, that could be indicative that there's a bleeding in the brain. It's called subacute hemorrhage. Uh, in case of children, change in posture. Suppose the child is having headaches with change to upright posture versus lying down. It could indicate that the pressure in the head is suddenly dropping. Uh, it could be associated with the neck position. Uh, it could be associated with visual discolorations. So that could, or maybe visual obscurations. That could be indicative of some pathology like papilledema, but the what should I say? Uh, Blood vessels in the retina, that is the inside of the eye, get affected due to increase in pressure in the inside the head. So these are things that could be warning signs. And uh, in short, if the child is having headaches uh, suddenly, if the headaches were not present earlier, if the child was otherwise doing well and suddenly has started having headaches, chances are that you need to go to the doctor. I'll stop here, and if there are questions, I'd be happy to answer them.
Thank you so much, sir. It was really enlightening and was something wherein the general public can relate to. Yes, migraine in children is a complicated problem, and we should be educated about that. There are a few questions. If you allow me, then
Definitely.
I will ask. There is a question from our viewer that if a child is suffering from migraine, what type of environmental setting do we require to have for that child? Uh,
There are two
I
things.
think yeah, sir. Please continue.
There are two things. One is the environmental setting before the child has headache. The second is the environmental setting after the child has headache. Uh, the first is having a quiet place where the child does not get stressed. Suppose some children have stress as a trigger. When they go out in the sun, that sudden change in the brightness of the sun that could precipitate a headache. So for your particular child, you'll have to identify what are the triggers and you need to avoid them. In certain children, taking chocolates is a trigger. There are other things. Suppose the child is otherwise doing well, but whenever the exam season comes, the child is getting headaches. So these are things that need to be dealt with. Now, you can't deal with everything. For example, the exam, what to do about it? So, in such cases, the modification that would be applicable is you need to teach your child how to cope with it. There's a thing called behavior modification therapy or cognitive behavioral therapy. These could change the internal environment of the child and help him cope better. Coming to the environmental changes when the child is having a headache. In that case, you need to give your child room to relax. So, in that situation, you'll have to allow your child to rest, maybe in a dark room, as the child prefers, and maybe let the child sleep off. Often, such headaches clear with sleeping, but that's not always the case. In fact, that uh, the child is having headaches still in the morning after getting up. If that happens, that is a typical presentation of migraine. And if such a thing happens or uh, remains present, definitely you'll have to manage accordingly.
Thank you, sir. And there is another question, which I think that it is actually the question of everyone. A headache is a headache, and whether it is a migraine, whether it is a sinus type of headache, whether it is a tension type of miss, there are so many variants of headache. The child will complain that I am having headache. The parents will perceive that I will have he or she is having headache. But how to identify that the type of headache he is having is migraine?
I've already
So what
mentioned,
type of,
yeah, I've
is
already
there
mentioned that.
any sorry to interrupt you, sir, is there any particular type of questionnaire or something like that that the parent should ask child to identify that the child is suffering from migraine?
Yes, but I think rather than going in a questionnaire for a parent, it would be better if they just come to the doctor if they think it's severe. There are two categories. One is they think no, the child is able to continue with their normal day-to-day activities. If that is the case, I'll say wait and watch. If that is not the case, I'll say uh, if the child is unable to continue with the activities, normal activities. If the child gets bugged down, I'll say you'll need to go to the doctor. Let the doctor diagnose. The reason I'm saying this is rather than headache, rather than migraine, the more concerning thing is secondary headache. So that should not be missed. Migraine is a treatable condition, but more ominously, secondary headaches like that which occurs due to brain tumors and things like infection of the brain, those are what we really need to be concerned about. Migraine is a bothering thing, but nevertheless, it's a simple headache.
A similar type of just an extension of your what you have told us, that migraine is a treatable condition. uh, One of our viewers uh, is asking that what is the duration of treatment, sir, for children particularly?
Uh, for migraine, the treatment will vary with the response of the child. In certain cases, even with medication, the headache will not go away. So that is a problem that we will have to face. In other cases, they respond beautifully. Now, talking about this, I've already mentioned that the treatment is of two categories. One is you need to give a medication daily. The other is the child has now already got a headache and you're treating. So for the abortive type of therapy, that is the second one, you're giving only when the child gets it. So it has basically no duration. If the child has a headache, you do it, it resolves, chapter closed. If you give the medication and it does not uh, go away, if it remains for a day, 2 days, 3 days, or more, that is a concern, and probably you need to hospitalize the child. But luckily, we see those cases less often. But if you're going to give a preventive therapy when you're starting the medication, continuing it daily, we usually continue it for a few months. See if the child is otherwise doing absolutely fine. If the child is doing fine, we gradually bring down the dose. And if the child is still doing fine, okay, we say, come on, let's stop the medication. If the child is still doing fine, what more do you need? But migrainous headaches do come back. In that case, uh, maybe even after this stopping the headache, maybe the child is doing well for 6 months. After that, the child gets a headache again.
Okay, sir. And there is another question. Uh, it is from Mr. Shan. Can cerebral palsy child prone to migraine? Means he wants to ask that
Got it.
a cerebral palsy patient is what is the chances of that patient developing migraine?
We don't have definite data about children with cerebral palsy, but there's no reason to distinguish them from other children. Like other
Yeah.
children, they are also prone to getting headaches, just like the other children. So there would be a certain section that can get headaches, and the management will just be the same. Anything more?
Yes. Thank you. And it is it yeah. I will take the last one if you allow me, sir.
Definitely.
I will take the last one, sir, if you allow me. Yeah. So
Sure.
it has been known that migraine treatment and the lifestyle changes are both closely associated. So that is actually the recommendation for adult migrainiers. Is it the same recommendation which is required for the migraine with children also? Because children are quite active already. Then what the adults do?
I couldn't exactly follow.
I mean to say, sir, that if the lifestyle modification is recommended for children's too, who is having migraine?
Yes, as I mentioned, that children can have headaches, and in that case, relaxation and behavioral modification play a lot of role. We need to also find out whether there are particular stresses. There are a lot of stresses that cause headaches. So, if we can identify the stresses, we need to ask them to avoid those, and that is the sort of migraine. That is the sort of what should I say? Uh, Modification in lifestyle that we are looking for.
Yes,
I can see
right,
a
right.
question that somebody has asked that a child is suffering from seizures. Uh, the
Yeah,
child is on valproate and
yeah,
will my son recover? Now, that
yeah.
is entirely unrelated. Seizures are treatable, and definitely there's a significant chance that the child will respond to the treatment. So I'd expect that yes, with correct treatment, with the correct identification of the type of seizure, uh, with correct choice of the anti-epileptic drug, your child should definitely recover.
Yeah, and the questions are pouring in, sir. And
Uh,
there is another one you
Another,
can see.
another, yeah. Another question is that the food and triggers of migraine.
Yeah,
No, about this, the particular thing that I'll mention about is chocolate and coffee. These are two potent migraine triggers, but that often varies with the child. So often we have seen that a particular trigger does not act as a trigger in another child. If that happens, that's once again specific for that particular child, and we'll have to identify that the specific triggers that occur for this particular child, will have to avoid them.
yeah. There is another comment, but that's not a question. That is something which you have already stated, and you have already explained it in length. That she is Gagi Mandal, and she is saying that I have severe migraine when I go outside at daytime under high temperature. During daytime, migraine starts. So these are few things which
Now,
people are actually
talking about,
suffering.
yeah, what she's asking is, suppose I get a headache for um, after going into the sun, do I need to take a medicine? The thing is, suppose you start, you get a headache. Now, if you take the medicine immediately, the medicine will still take, say, half an hour to um start acting. So, this is not something that will start acting on its right away. Uh, in that case, if the headache is just lasting for 5 minutes, you need not take. But if it lasts more, probably you need to take a medication. In this context, I'll mention about the triptan sprays that are available. So these nasal sprays can stop your migraine instantaneously. But before use of those medications, you'll have to confirm that this is a case of migraine and not any other headache. If it is some other headache, these medications would not prove useful.
Right, sir. Thank you so much. This was a fantastic session, and I'm sure that the viewers will take the maximum advantage out of this. I'm sure that the learnings of this session they will apply at their home, and they will have a better care of their children who are suffering unfortunately from migraine. Uh, Thank you so much, sir. On behalf of Altius Biogenics, I thank you a lot for taking out time from your busy schedule. And have a good night, sir. Thank you so much.
You people also have a good night. In these COVID times, I wish health to all. Stay well. Thank you.
Thank you, sir. Thank you.